Thank you,
have some
Mr.
agreement,
Speaker.
so go ahead.
Mr. Speaker, I rise today on order number 93 of our standing orders with a deep sense of urgency to address an alarming phenomenon. Many young Ghanaian women are losing their lives during or shortly after childbirth. According to the Ghana Statistical Service's 2024 thematic brief on maternal mortality, the second and most recent maternal health survey conducted in 2017 estimates, Mr. Speaker, that Ghana's maternal mortality ratio is estimated at 310 deaths per 100,000 live births for the 7 years preceding the survey. This figure is corroborated by the World Health Organization in its 2025 Trends in Maternal Mortality Estimates 2000 to 2023 report. Ghana's rate remains significantly higher than the UN Sustainable Development Goal target of 70 per 100,000 live births by 2030. So Ghana is 310 deaths per 100,000 live births, and the UN SDG goal is 70 per 100,000 live births by 2030. A recent 3-year study from the Kolebu Teaching Hospital from January 2021 to December 2023, which was published in the American Journal of Obstetrics and Gynecology, the global reports in March 2025 of this year, reveals a shocking maternal mortality ratio of 801 per 100,000 live births over a 3-year period at the Kolebu facility. 801, Mr. Speaker. That's unacceptable. Hypertensive disorders accounted for 40.7%, while hemorrhage caused 28.4% of audited maternal deaths. So the non-audited, Lord knows. This was among girls aged 15 to 19. The maternal mortalities due to hypertensive complications were as high as 529 per 100,000 in the same research report. These are not just statistics, Mr. Speaker. They are lives lost to systematic failures in maternal health care. Mr. Speaker, the leading causes of these maternal deaths are postpartum hemorrhage, eclampsia, sepsis, obstructed labor, and complications from cesarean sections. These causes are well known and treatable. Let me repeat, these causes are well known and treatable, yet 81% of pregnancy-related deaths occur at home or within 24 hours of admission per the 3-year research study. This reflects the enduring impact of the 3 delays in basically, one is deciding to seek care and in reaching a medical facility, delays in receiving timely treatment, and delays in treatment upon arrival. These dangers are magnified by long travel distances, broken referral systems, and overstretched facilities. Mr. Speaker, an article published by the Lancet Global Health on March 7, 2025, and reported by the World Health Organization identifies hemorrhage, which is severe bleeding, and hypertensive disorders such as preeclampsia as the leading causes of maternal deaths globally. According to the report, these conditions accounted for approximately 50,000 to 80,000 maternal fatalities, respectively, in the year 2020. This alarming data stems from a multi-systematic review conducted to examine the root causes of maternal deaths occurring between 2009 and 2020. Mr. Speaker, these findings underscore the urgent need to strengthen maternal health systems, particularly emergency obstetric care, to prevent avoidable deaths and safeguard the lives of mothers in Ghana and the world. Substandard care, Mr. Speaker, further compounds the risk of maternal mortality. Failures such as misdiagnosis, delayed emergency interventions, and poor resuscitation practices. Mr. Speaker, globally, countries with robust maternal health systems report far fewer maternal deaths. Germany, for example, had a maternal mortality ratio of just 4 per 100,000 live births in 2023, according to the World Bank's Gender Data Portal. And Ghana, per the Kolibu report that I just cited, was 801 per 100,000 live births. Germany was 4. Malaysia and Sri Lanka have achieved dramatic declines in maternal mortality by expanding community-based midwifery programs and investing in emergency transport and referral networks, as described in the World Bank's Investing in Maternal Health report and the Sub-Saharan African Transport Policy Program analysis published in April 2025. Mr. Speaker, our healthcare professionals continue to work heroically under immense pressure, but their efforts are undermined by poor infrastructure, lack of essential medicines, and a fragile referral system. Mr. Speaker, no woman should lose her life while giving birth life. No woman should lose her life while giving life. Every maternal death is not just a tragedy, it is a failure of our health system, our governance, and our collective responsibility. Mr. Speaker, this is not a woman's issue alone. It is a national development crisis. Beyond the human cost, the economic and social impact is severe. The loss of mothers leads to broken families, reduced workforce participation, and long-term poverty, especially in rural areas. Mr. Speaker, we must act decisively to reduce maternal mortality in Ghana. As such, we must adopt a comprehensive and coordinated approach that addresses both the systemic gaps and the human realities of maternal care. To that end, Mr. Speaker, we should scale up midwifery training and deployment to meet WHO's ratio of 1 to 175 provider to population ratio. We must also equip district hospitals with essential medical equipment, blood banks, ICU facilities, and essential medicines. We need to strengthen the referral system specifically for obstetric emergencies. It is essential that we institute mandatory in-hospital or clinic maternal death audits and enforce clinical protocols for emergency obstetric care. Mr. Speaker, respectfully, this House must act with urgency and resolve. Let this honorable House commit, not in words alone, but through concrete action to addressing the high incidence of maternal mortality in Ghana. Mr. Speaker, respectfully, there must be an inquiry as to the causes of the high rate of maternal death during childbirth or immediately after childbirth in Ghana. Is it due to complications during natural or cesarean sections? Or is it due to lack of antenatal care? Is it due to medical negligence? We must investigate the causes so that they can be addressed and prevent further deaths of mothers-to-be. Mr. Speaker, let us ensure that no woman, no female in Ghana dies giving life, which death could have been prevented. Let us build a nation where motherhood is celebrated, not mourned, where giving birth in Ghana is safe and not to be feared. Mr. Speaker, I was speaking to some young women in my constituency, and what they said was very depressing and sad. They said they're pregnant, they're like in their 9th month, 8th month, and their fear was giving birth, Mr. Speaker. We're in 2025, and the fear of these women is giving birth. How could that be? We must address this so that we prevent these preventable deaths, because they are preventable. The data shows that a large number of these maternal deaths are preventable. Sure, some will, you may have some that may not be preventable, but if you look at the data, it says that a large number of the maternal deaths are preventable because the causes are known and there's treatment available. So, Mr. Speaker, I thank you very much for the opportunity.